My name is Melinda Skirvin, and I'm here to introduce you to the subject of Certified Nurse Midwife. This position was of great interest to me and my group because of the many benefits that this position brings to women and women's health care. The first modern-day nurse midwives were British-born and brought to the United States in 1925 by Mary Breckinridge. At first, these nurse midwives provided care for remote areas such as the areas in Kentucky, but then became more mainstream after the first school opened in New York that very same year. What's great about this position is the emphasis in the partnership that takes place between the women, the families, and the certified nurse midwives. It allows the women to be active participants and to make decisions in their health care needs, very unlike the more traditional physician-directed care. The certified nurse midwives are primary care providers, and not only do they provide care for the women during pregnancy, but they provide care for family planning as well as postpartum, and as well as, believe it or not, the care for the newborn for the first 28 days after they're born. And they even, I was surprised to find this out, they even provide care for the male sexual partners if they're suffering from STDs. The certified nurse midwife fills in many gaps that are left from the physician-based care that's more traditional, and also allows for great women's care in more remote areas of the United States. Certified nurse midwives are actually becoming more popular in their use. Some of the last information that's been published was from 2014, and in that information, it talks about how the certified nurse midwives, they've increased their attendance of births every year since 1989, and that in the year 2014, they attended 332,107 births, and that's about 12.1% of all U.S. births. That is huge. In 2014, 94.25% of the births occurred in the hospital, with 3% in freestanding birth centers and 2.7% at home. The at-home births are actually increasing, and that does seem to be one of the areas that there is a greater use of certified nurse midwives. Not only has there been an increase in the use of nurse midwives, but there's also been a lot of benefit that's been documented as a result of using nurse midwives. In the article Midwifery Benefits, Improved Outcomes for Moms Using Midwives, there was a Cochrane Library review which involved 13 trials and over 16,000 births. And in that review, there was an increase in the number of people that made their gestation period over 37 weeks, and a decrease in the loss of births under 24 weeks. One other interesting piece to this review was that through the use of certified nurse midwives, they actually saw a decrease in the gap between high-risk births and the issues that they may have experienced with regular births, and they were able to decrease the amount of issues that took place with the high-risk births. And then also in this same review, they did note that they were much less likely to use pain medication, epidurals, forceps, or vacuums, and had a much faster recovery period after the birth. Clearly, these results have shown that there is great benefit to the certified nurse midwife position, and that there has been a great increase, and will probably continue to have a great increase year over year, and definitely the benefits are obvious.
Hi, my name is Emily. I'm going to be talking about the education requirements to become a certified nurse midwife. In the United States, there are over 40 midwifery education programs, which are accredited by the Accreditation Commission of Midwifery Education. There are a few ways to become a certified nurse midwife. The first way is their traditional program, which is the BSN nurse looking to obtain a master's in nursing or a doctor of nursing practice. There is a doctor of nursing practice option only, and that's either a BSN or a master's in nursing student who is going straight for their doctor of nursing practice. They also have a bachelor's degree option, and that is for anyone with any type of bachelor's degree who wants to become a certified nurse midwife. They must go to nursing school along with getting their certified nurse midwife education at the same time. To be licensed as a certified nurse midwife, you must first pass a national certification board, which is given by the American Midwifery Certification Board. Once you have passed this exam, you are then eligible to be licensed healthcare provider in all 50 states. Before you can actually take this exam, you have to have a couple things. First, you must be a graduate from a graduate degree program. You must have finished your program within 24 months. You must have a proof of your RN license. You must also have a letter of recommendation from the head of your midwifery program. You must also pay the fee to take the exam. Once you have passed the exam, you must renew every 5 years through the American Midwifery Certification Board. And that is about it.
Hi, my name is Karen Trevelick, and I'm going to talk about the standards of care, the scope of practice for a certified nurse midwife. The nurse midwife, the certified nurse midwife, can provide a wide range of practices. They do pregnancies, they do gynecology services, they do women's health, just a variety. First, I'd like to talk about the managing of the pregnancies and the delivery. The certified nursing midwife, they will monitor pregnancy and deliver the baby as long as the mother and the baby are healthy. That's the main qualification for it. If there's any problems, then they will be referred out to another services. The nursing midwife will also order an ultrasound, sonogram, labs. She can, he or she can interpret labs and order any kind of testing that needs to be done just to ensure the safe pregnancy and delivery. The nursing midwife is the hands-on when it comes to delivering the baby. She or he is right there. And she also will follow the newborn for the first 28 days of life and do the checkups and order any blood work that's necessary to ensure that the baby is healthy. And the follow-up care for the delivery for the mom, if the birth is in a midwifery center, like a birthing center, the mother and the baby will go home the same day. They're kept there, the mother's kept there for approximately 4 to 5 hours just to ensure that everything is okay. And again, if there's any test or anything that needs to be done for follow-up, then she can refer the mother out and the baby, or the baby, and order any test that needs to be done, but they follow up to make sure that the mom and the baby are safe. And like I said, the newborn care for the first 28 days, and then the baby is referred then or prior, even before then, go to the pediatrician, but the midwifery will take care, follow the baby for the first 28 days. The nurse midwife also manages the therapy of additional women's health. They will provide gynecological services. They will monitor their health. They can do any kind of testing, labs. They can write prescriptions. If there's a suspected, or actually if there is a sexually transmitted infection, then the nursing midwife can actually also treat the male partner. There is a wide range of services that the certified nursing midwife does. They do nutrition, health, they do healthy living, they do a variety of services, not just, delivering babies and taking care of the pregnant women. They do family health, anything basically is for adolescents all the way to postmenopausal. They will take care of the females and the women. So they has a wide variety of scope. Their scope of practice is really large. It's basically they take the replacement of the family physician as far as the women go, and they only treat the men obviously if they have to treat them for the STI. So that concludes my standard of care and the scope of practice for the certified nursing midwife. Thank you.
Hi, my name is Adirayo. I'm presenting Certified Nurse Midwife, the impact on the nursing profession, nursing shortage and care outcome. Many midwives leave the profession because of stress and burnout, and this leads to increased workload on the practicing midwives. The impact on healthcare reform and economics. The works of the certified midwife provide access to maternal health care, especially in the rural areas. It reduces higher infant mortality rates, lower healthcare costs by safe delivery and lower cesarean section rates. Impact on evidence-based practice, lower rates of induction and augmentation of labor, increased awareness on readiness for labor and birth, higher rates of breastfeeding for healthy babies. Legal issues for certified midwife. They undergo risk reduction strategies on antepartum, intrapartum, and postpartum care, confirmation and documentation of care, safety handling and monitoring of newborn. On quality of care, let's continue education assessment, collaborate with OBGYN physician for quality care, providing emotional support for pregnant women. Thank you.
So for the conclusion of this certified nurse midwife presentation, you can obviously see that certified nurse midwives offer high quality care through evidence-based practice that offers a unique experience for each and every person. Certified nurse midwives continue to have a high satisfaction rating because of their individualized, hands-on approach.